So welcome everybody. I'm Gilberto Belli. I'm the scientific head of IBSA Dermaesthetics. I really very welcome you to this first digital symposium in the first IBSA Simpo, Digital Simpo. I would like to introduce you a little bit IBSA company. IBSA has been founded in 1945 and it works in 9 therapeutic areas. One of these therapeutic areas is dermaesthetic, where we put all our hyaluronase expertise. We are, I think, one of the few companies that control the entire life cycle of our product, starting from the production of the raw material. And of course, we use our ultra-pure hyaluronic acid in our brand, Aliaxin, Viscoden, and Profilo. Our mission is a little bit different from the mission of other companies, because yes, we aim to correct, volumize some area patients, but through tissue improvement and regeneration. For us, it's very important the taking care of our patient. So I'm very proud to introduce our 2 international speakers, Beatrice Molina from UK and Riccardo Forte from Italy. I would like to thank both speakers, first of all, to support us from a lot of time and to help us to develop new technique and new approach that you are going to see today. So Beatrice, the floor is yours.
Thank you. Good morning, everyone. And thank you for joining us on a Saturday morning. Really, we thought we'd start maybe having a look at what is happening today in the aesthetic market. We're all very worried all the time about how we're going to be moving forward and catching up with this new generation. And of course, the new generation millennials is what we know as Generation Y, is definitely has got a very strong hold now into the aesthetic market. If we look at the figures in the US, they represent about 83 million. That's about a quarter of the population. We do know about this generation is, of course, they spend most of the time on mobile phones and all the tablets and computers, etc. But what are they really seeking? What is very different with this new generation is they're actually looking more for this holistic approach. And they're really investing a lot of money into the prevention of the anti-aging medicine. So they're really one more step ahead. And of course, we're going to have to develop a lot of different strategies in our own clinics to be able to capture them and to actually maintain them. So what procedures are they seeking? On the next slide, we can see that they will be looking at the same things than everyone else. Of course, fillers, of course, botulinum toxin treatments, and everything is to prevent the aging. Of course, the first thing they may come to see us for is their lips, and then maybe a little bit later, when they start showing the first signs of aging, they will be moving more to maybe cheek fillers or more definition and contouring. And what we do know now is that obviously about 49% of the growth is going to come from this generation. So really, we need to watch how we are obviously bringing them to our clinics, but also how we're going to maintain their interest and maintain them into our books. So looking at the next slide, what is the main difference then between obviously our usual, at the moment, patients, which are the mature ones, in comparison to these millennials, which are obviously coming? As we can see in this picture, it really represents very clearly, in a mature lady, we're going to see a lot of changes of the sign of aging. So you're going to lose volume, you're going to have elasticity lost. So we have to actually do a much bigger job. It's even more 3D from restoring, when in the millennials, we're being looking more at increasing their own beauty, but also maybe working on enhancement rather than in a restoring. And this is where Riccardo can run a little bit more about the different concepts we can see when we talk in aesthetics about how to work on the face.
Thank you, Beatrice. Good morning to everybody. So yes, it's really true. Approaching. So can we go back one slide, please? Approaching. One more back. Okay, approaching a young lady or an older lady. Of course, our target, our aim is different. So when we talk about fillers, we think about volume, but volume can really have different shape and different actions in the way we apply it on the face. So we can choose different gels, we can choose different anatomical size and different injection technique in order to develop different actions. For example, when we approach an aged lady, we need to rejuvenate. We need lifting action. We need to tighten. We need to volumize those fat compartments that has lost volume a long time. So the injection sites and the strategy will be adapted to this specific aim. And next slide, please. When it comes to millennials, no, one back, please. Okay. When it comes to millennials, we are not focused on aging signs. We don't have wrinkles to correct. We don't have fat compartments to restore, but they just want to sculpt. They want to enhance their own beauty. So the action that our gels, our fillers has to achieve to perform on the face are absolutely different from the approach when we want to restore some aging signs. And the approach in millennials introduced the concept that we developed the next meeting that will be my evolution approach. Next slide. So, as I said before, we have to adapt the choice of our filler in order to obtain the rheological effect that we want to achieve. Some gels for rejuvenation, for tightening, for volumizing, in order to remodel, they have to be soft. They have to be able to adapt to dynamic tissue forces. On the contrary, when we want to lift, when we want to sculpt a zygomatic arch, we want to sculpt the chin, of course, we need a filler that is able to maintain the shape. So when we inject it and we create a projection, the gel has to resist. It has to be a very responsive gel in order to resist to the stress and maintain a long time the projection. So Beatrice, how can we adapt the rheology when we choose our filler?
Exactly, because if we don't know what the fillers we got and how we can really, if we don't understand the rheology of our own filler range, then we cannot really create that wonderful work Ricardo has been telling us about, because it's important to really know the G prime of your product. That's the #1 key element. And like Ricardo just said, if you go a high G prime, that means you're going to have to work deeper. It's a product you're going to be able to put just superperiosteum on deeper layers, because it's going to give you a lifting effect and a volumizing effect. But because it's more rigid, it's going to have to be deeper in those layers. If we go for softer products with a low G, that means they can be more superficially placed, so we can mold and sculpt a little bit, but you're not going to create that lifting as we see. And of course, the second parameter, which is very important, is the tan delta. So with these, as we can see on the video, if you go a filler, which is go a tan delta, which is above 1, that means it's going to behave like a liquid. So it's like water. If we go a tan delta close to 0, we'll be closer to a more solid, so it will be more rigid. So really, in an ideal world, you want to fill out in between a 0.1 and a 0.6. That's obviously the best ones to work with, and you will choose one or another depending on what you are trying to create. So let's have a look then at the portfolio for the Aliaxin range. So just to put it into context, we got these beautiful 6 products. So on one left side, we can see the shaping and contouring range. So that will be our SR, FL, and GP. And of course, the one we're focusing today is on our volumizing products. And we have got Evie, SV, and of course, now we also got LB for the lips. So, Ricardo, how can we now use these products and obviously looking into the rheology and how you will present it onto a lady, say, of an aging?
So actually, this is the point. So we have to transfer the theory into practice. So let's see on this picture. When we want to rejuvenate, when we want to delete some superficial wrinkles, when we want to stretch a little bit the surface of the skin, of course we need a very low G prime, because the gel has to be soft, the gel has to adapt to the dynamical movements of the mimic of the face, you know, and the tan delta has to be quite high, because this product is meant to spread and to integrate in the tissue. Otherwise, we would see overcorrection on the surface. On the contrary, when it comes to ligament stretching, or when we want to create a real lifting, elevating effect, we need a gel that is able to maintain the shape when we inject it. So it shouldn't adapt so much to the mechanical stress. It should be able to maintain the projection and the stretching of the ligament. So in this case, this product will be injected very deep. I personally prefer to inject with a needle directly on the periosteum. My anatomical site, my target is the base of the ligament or the insertion of the muscles. And then when I inject, I'm sure that with the high G prime, I can stretch the ligament, and the ligament is able to elevate all the soft tissue of the cheeks. So this is the real action that I want to achieve, you know. And when it comes to the cheeks, for example, volumizing in this area means smoothening, means creating softness, means stretching the skin. So, of course, this volume has to be a little bit softer than the one we need to stretch the ligaments. We would inject it in a more superficial layer, and in this case, in the fat compartment, so in the subcutaneous layer. And probably we will choose a cannula to better deliver the product in this area and for a very nice contouring effect. So knowing the rheology is one thing, applying the rheology in practice is something different. So think always when you approach a project of rejuvenation, think of what you are doing and how you choose your tools in order to obtain the action and the final result you are trying to create. So next slide. We see clearly from left and right the repositioning of the retaining ligaments, and this is due to the action of an IG prime filler. So when we obtain this kind of elevation, when we obtain this kind of tightening, we see in the next slide, we see the perfect, no, one back, please. Okay, we see the perfect combination, the very well balanced result within that is including elevation, sculpting, contouring, skin tightening, fine refinement of fine wrinkles. So you see the natural and well homogeneous result combining the different rheologies of different products. So Beatrice, do you want to say something more maybe on this?
No, totally agree. And I think that's why the challenge is actually the mature patient in one way, because we're restoring. So we have to work, like you're saying here, in about different layers to create this. Obviously, when we're looking at the millennials, we're looking more at that shaping, we're looking more at the enhancement of their features. So it's maybe a little bit simpler, but that doesn't mean it's easy, because we still have to respect the natural anatomy and to respect how they look, so they look better without making it too exaggerated.
Yeah, it's true. I strongly believe that working on millennials, on young ladies, young people, is much more difficult because you don't see the sign you have to correct. So in aged skin, you see something and you want to correct it. So it's very different when it comes that you have to create something that you don't see. So your sense of beauty, your creativeness, everything has to be improved. And the tools that you have to choose, of course, they are really important, because you won't obtain the result and the action you want to create if you don't have the right tools. So in the next slide, we can see a short video how you can interact with the ligaments, and you can project better the bone profile. So in this case, I stretch a little bit the ligament upward, and then I inject with the needle perpendicularly right on the periosteum in order to stretch the ligament and pull with the ligament all the soft tissues up. So you can see on the image on the skeleton how we position the gel. And of course, this gel has to maintain the projection, because otherwise, if it collapses, if it migrates somewhere else, you will obtain only roundness, but you create weight on the face. If the gel maintains the stretching of the ligament, and then you will see a sharpness, you will see a projection that is elevating the face. So we can go on the next slide, and we see Beatrice injecting now.
And of course, you can see why in this case we will choose SV. We're trying to bring urology to the reasoning. So SV is the one with the major lifting capacity of the range and with the highest G prime, which means it's the perfect one to work, as we've seen on the previous video when Ricardo was showing the depth of the needle and how to support it. Because when we go, like in this case, a heavy face, the last thing you want to do is create more volume. You don't want them to be exaggerated. So, but what you do need is to lift that tissue and to work upwards to recreate the shape. And it's just a very simple injection technique, as we've seen already. So we just go very quick on the next photo, just a before and after. So you can actually, on the next slide, please. And if you play the video. So we can actually see there how we have managed to lift the tissue without actually making her bigger. Okay, so now if we go on to the next one, onto the next slide, this is more challenging now, because what we got here now is Evie. So Evie is the second one when it comes to G prime, so it's a little bit less, but it's still obviously for contouring, and it's still as a volumizer. So where will we use this filler? So it's either on a young person who just needs a slight contouring, they don't want to be too exaggerated, we just want to create a slight lifting effect. And what I've chosen in here for the entry point, as you can see with the cannula, is the higher part of the cheekbone. I used a 23G needle to just literally do a small hole on the skin, so then my cannula will glide very easily. I want to go obviously deep, but I don't need to necessarily go above the bone, so I can glide my cannula parallel to this to the cheekbone I want to enhance, and then with linear retrograde, just very gently place the product. And like Ricardo said, with this technique, you get that sort of contouring, molding, softer look. Of course, if we look at the second video, there is another possibility of an entry point. I use this in the case that maybe I need to restore also the tear trough and the mid-cheek fat pad. Obviously here we're just using it for the cheekbone, but this is a different option if you're worried about contaminating your cannula with the hair and you just prefer that access point. And again, it's the same idea, and it's great on a mature patient with thin skin, where you are worried that a very high G prime will show too much and it will actually show the filler too much. So really you can use a little bit softer and still create a very, very nice result. So we can have a look very quickly at the before and after photo. And again, we can see there is on the next slide an improvement on the shape, a little bit of a lifting effect, but much softer than in the previous one. But as we see, as the volume loss in this patient is much higher. So it has got a lot, as I said, a different type of challenge to a lady who's got much heavier tissue. So what do you think, Ricardo? What do we go next? What are the millennials looking for?
As we said before, millennials are looking for something that can enhance their authentic beauty. So this is actually a harder challenge for us because we have to interpret what is in patient mind, and it's not so obvious what we have to do, because as we said before, we don't have specific signs to correct. We have to interact with lights and shadows. We have to interact with the emotional pattern of our patient. So the discussion with the patient is very important, and we have to really enter in connection, with the patient. So what they very often want is an enhancement of the 3D beauty of their face. So we become a little bit as sculptors that are working on faces, sculpting lights and deleting shadows and moving volumes from one side to another one. So this is a very nice challenge, and this is something that is really stimulating me during my practice. So we will, so for this, we developed a very interesting approach, a very strong tool for communication that is called my Volution approach. And we will discuss this approach in the next meeting. So in the next slide, we see how the volume in this approach takes a new meaning of sculpting and remodeling, and not really lifting or tightening or deleting wrinkles. It's something that is more related to creating different shapes and molding the shapes of the face. So this is very interesting, and the choice of the product is really the right choice is mandatory in order to obtain the right correction. So when it comes to lips, that is one of the most frequent requests from our patient. We have different ways to work on the lips: volume, shape, vertical diameters, tightening, improving the mucosa appearance, sculpting the philtrum. But very, very often, we can see in the next slide that the sculpting process in lips in millennials is actually what they request. So this is a case of mine. So she came with nice lips that we can see on the left. She already had a good volume, good shape, but she wanted something more. So in the first appointment, in the first session, I increased a little bit the shapes, I increased a little bit the volume, I created a 3D effect that I thought it was enough. She came back after 2 weeks and she said, yes, I like it, but I wanted more. I want to enhance the 3D effect. I want more light. I want a more tightened mucosa. I want a very brilliant effect of the mucosa. So I added some filler, and I tried to interpret the needs of the patient, creating more sculpting effects, shaping, forcing a little bit the shape of the lips. And in the end, she was completely satisfied. So this is actually what they ask us more frequently. shaping, remodeling, and you know, trying to express the best sensorial, sensual, and you know, emotional aspect of the lips. So, Beatrice, do you want to add something to this?
Well, apart from that, it's a beautiful result. It's true, and it's a challenge to maintain the natural anatomy of this lip and not distort it. And I think that's a very common mistake we find when people try to use products with with high G prime to create that very quick volume. If you distort the anatomy of the lip, then they don't look right. They look fake. They don't look good. When this one looks like naturally, she has got a beautiful lip, isn't it? And this is why it's important to look at the characteristics of the lip filler you're using to create the effect you're looking for, which I can see on the next slide. Ricardo is going to tell us a little bit more about LV.
Yeah, so as we saw in the picture, the one very important thing is being able to sculpt and create shapes, but as Beatrice said, the natural look has to be respected. So we were missing a product that was a good sculptor, but still give a very natural and soft effect, action to the lips. So the new Aliaxin LV is a lips volumizator, but actually I like to call it lip sculptor, because really the perfect balance between the tan delta, so the capacity of diffusion of the gel, and the optimal G prime, so the combination of these two modules is really allowing us to sculpt but maintain softness, and the gel won't be palpable, won't be touchable in the lips, because this is a very sensitive area. So patients need to not be able to feel that they have something on the lips. So the touch, the feeling, the movement of the lips has to be respected and has to be very, very natural. So
Sorry, Ricardo, I was going to say, is what you just said is really, really important to focus, because is that integration of the product within the lips, isn't it? So that's why they feel soft and they're moldable and they're kissable. And I think that combination of the three, as we can see at the bottom there, where you got that cohesivity with the lifting effect and obviously the sculpting effect, and all that balance of that is made this a very, very special product.
Yeah, I absolutely agree. And how we will see in the video later, you can also inject it with very small needle, because the flow, the resistance in the injection of the gel is very soft. So really, as you said, it's moldable, it's handable, and really it's really a pleasure, you know, to sculpt lips. You can inject it deep in the muscle, you can inject it superficial. So, and now we come to the next slide, where we have to remember that there are so many actions, so many techniques that we can apply on the lips. So definition, tightening, projection, eversion, volume. So, and we have to be able to inject with linear technique. We have to be able to inject with droplets. We have to be able to inject with bolus or with cannula. So a gel that is able to adapt to different injection technique, to different anatomical sites, and that is able to, that allows you also to do very small, very fine refinement. This is actually the perfect gel to interact with the lips. Beatrice, what do you think?
And of course, you're right, because everyone is going to feel more comfortable with a needle or with a cannula or a combination. And it's just depending on what effect you're trying to create and where you're going to place that product. And this product needs to adapt to every technique, so you can actually be very more variable or very multi-adaptable to all the requests.
Yeah. So we see now in the video that I am injecting first in the muscle, and I am pulling my implant upward in order to sculpt the philtrum and to elevate the border of the lips. So the first passage is deep in the muscle, and I'm injecting perpendicularly to the lips. Then after modeling the volume, I move more superficial, and I try and I start to define and make the border more precise and tighten the mucosa. So you see, with the same gel, with a very thin needle, because I am injecting here with a 33 gauge needle. So I like to change the needle, because with a very small needle, sometimes you can really be very precise. So, and the gel allows you, because as we said before, it flows very easily from very thin needles. So after injection, you can sculpt a little bit, you can model a little bit the gel with the fingers, and you can you can spread the gel into the lips, and you don't feel it anymore after you have been massaging a little bit the gel. So as we said, the natural feeling, the natural behavior of the lips won't be conditioned, won't be affected, and the final result will be very natural.
So Ricardo, is this you prefer a technique for the younger ones, or is it in general for everyone?
Sorry,
Is it you prefer technique for the younger generations, or is it a technique you use on everyone?
Well, this technique allows me to sculpt a little bit more the lips. So most of the time I use it on younger patients, but you can use it also with aged ladies, because very often the vertical diameter of the lips has to be improved also in aged lips, and it helps because the flattening of especially of the upper lip is really affecting the smiling and the harmony of the lips. So I use it more for sculpting, but also for rejuvenating.
Thank you.
So
and
you see,
to the next slide. This is obviously for the one of you that prefer to use a cannula. So there is obviously another option, an entry point outside the commissure of the mouth, again with a 23G needle, and still my preference is a 25. Because if I want to go intramuscular or into the areas which is a little bit deeper, we know from anatomy that it's a little bit higher risk for the blood vessels to run through there. We know it's still an 18% can be superficial, of course, and there is a lot of anatomical variations. But if some of you are a little bit more concerned, obviously a cannula is an alternative. But the only, I would say that with a cannula, you can only maybe do a bit of remodeling and a bit of volumizing of the lip in a projection way. You cannot really do what Ricardo was achieving with the needle technique. So sometimes you may have to combine both, because that you can do different things with different ways of depositing the product in the lip. Don't you agree?
Yes, absolutely true. And not always our patient want to sculpt the lips in a very visible, appreciable way. Sometimes they just want a little bit of tightening, they want a little bit of freshness in the lips, and this, as it shows in your before and after, the remodeling is very classy, is very natural, and in this case actually the cannula is really helping us, and you reduce also the bruising risk that is sometimes very important for the patient. So being able to adapt our filler to different injection technique really allows us to have a very large horizon of choice, so it's very it's much easier for us to work with different tools. So yeah.
So maybe we can move to the next one, and you can show us again with the needle, because it's definitely the most popular procedure, I think.
So we can start the video. Okay, so we see that I am using the filler as a sculptor, just to elevate some details in the lips. So I'm not treating the whole lip. I'm just trying to create two nice point of lights in the lower lip, creating a little bit of shadow in the middle. So you see, I'm not really focused on border. I'm not focused in shaping the whole lip, but I'm just creating this 3D effect in order to give to the patient that that reshaping that she's looking for. So this is the other side. You see, I'm injecting slowly. I have time to see how the mucosa elevates, and I adapt my implant in order to obtain the final result that I'm interested with. Also in the upper lip, we will see I'm just injecting in 2 points in order to feel that depression that she has in the middle of the upper lip. And this very focused and precise remodeling, I think in millennials are quite frequent, because sometimes you just need to help a little bit the lips in their appearance. They really don't need the total restoration, or it's different. In the case I showed before, there was a strong need of a very intense 3D remodeling. In this case, she's just looking for some different lights on the skin. So she wants just to, give that little touch that improves the beauty of the lips. So we can go to the next slide. And here is the same thing, because this young lady, she has fantastic lips already. She just needs a little touch up for some details that she likes to improve. She's already beautiful, but she's just looking for something that can improve, that can give that, that little detail that for her is very important. So this is actually the way we behave with millennials. They are looking for those little things that can really enhance their beauty. And
it's interesting, isn't it? Because a few years ago, we used to see people going, I want these lips, and they will bring some celebrity with a look, and they were seeking to get this look. Now they don't. Now they go, I like my lips, but I just want them a little bit plumper, or a little bit more elongated, or a little bit more shape, and they are looking to enhance their own beautiful features. So that is a challenge, isn't it, Ricardo?
Yes. They want to respect their own personality. They don't want to look like someone else. They just want to improve their beauty. So this is why, this giving us this gave us the idea for my Volution. So the patient very often come to us, and they maybe apply a filter, a digital filter on their pictures, and they want to delete some little details. And this is really helping us in the communication when they show their own pictures and we discuss on it. So, as you said, we are not emulating, we are not copying beauty, but we are sculpting individual beauty. So this is actually a different cultural approach in the relationship with our patients.
And I think with this, we probably are at the end of our first talk, I believe.
Yes, this is the last slide.